Thank you for being so prompt at the meeting. We're going to wait a few minutes because I know a few of the attendees were just getting off another call. So please wait a couple more minutes and thank you for your patience. All right, I think we'll get started. We'll keep an eye out for other attendees that will be joining, but wanted to thank you for this last session, number 6, on hands-on with data. You should have received in an email, 2 separate emails. You had different handouts, and this is the worksheets that we'll be using later on in this session. So please make sure that you have those in hand, and we'll be doing a breakout room to work on that homework. So again, Dorota Carpenetto is part of our analytic team at Mountain Pacific Quality Health, and she is responsible for supporting and interpreting and summarizing reports and presentation of data that is very clear, accurate, and meaningful to our quality improvement efforts. Dorota has 14 years in public health practice, including 12 working as an epidemiologist at the Montana Department of Public Health and Human Services. She also has 3 years of experience working abroad on public health and environmental issues. She has a BS in international business and a master's in public health from Tulane University. Her favorite part about data is bringing data to life or putting data into practice. So I'd like to introduce now Dorota Carpenetto.
Thank you, Sarah, and welcome everyone to our last data session. Today's presentation will be very interactive. First, we will be splitting into groups to work on a data assignment, which you should have received in your email. Then we will hear reports back from the break rooms. I will share a few chart templates that I designed for you, and then we will go over sets of data sources that CMS makes publicly available without needing to have signed data use agreement. Next slide, please. Now let us look at our assignment before you get redirected into your group. This table contains fake data for 4 inpatient services offered by the Valley Community Medical Center in 2019. Again, this is fake data. I don't even know if Valley Community Medical Center exists. Included are the inpatient costs per member per month for each of these inpatient services. Next slide, please. Now, based on the data we just looked at, please try to answer these 5 questions. If you attended my last session, remember the answers don't have to be long. So think about why you are looking at the data in the first place. Of course, we are making this audience up. Who's your audience and what tools you have to analyze, display, and share your data? think of what chart would you choose to display this data. And I provided this cheat sheet to help you make your decision based on the data you have. What can you do to highlight the point of your data findings? And what conclusions can you make about the data you illustrated in the chart? The data display cheat sheet on the left-hand side can help you make the decision, like I mentioned, based on the data you're dealing with. Now you will have 15 minutes to work in your groups to answer these 5 questions. After that, you will be prompted to rejoin the session. Please don't hang up. You will be redirected to the main room. Also, make sure you appoint a spokesperson from your group who will share with everyone how you answer these questions. Before this presentation, like I mentioned, we emailed you a couple of these slides, so please bring those up on your screen to help you with this assignment. I just want to put a disclaimer. This is the first time I'm doing this breakout session, so I apologize in advance for any hiccups in the process. Now you should be redirected to your break rooms to work on this assignment. Welcome back. I think we have everyone back from the break rooms. Sarah, can you bring up slide number 4? I mean 6, excuse me.
That was fun, by the way.
Oh, good.
Yeah.
I didn't know how that's going to work. Thank you for the feedback.
Oh.
Great. Awesome. Great. So we are all anxious to hear and learn from each group. To mix things up, we are going to start with group 3. The spokesperson from group 3 can unmute and share findings with the rest of us when you're ready. Go ahead.
I think, was that our group?
Yes, Jessica.
Okay. Okay, so hang on, I gotta bring up my paper so I can. So for answer number 1, we kind of concluded the point was just like the title of the data, just informing patients of what the cost would be for their elective activities. And that's kind of answers number 2 as well. Our audience is the patients, just so they know what they're paying before they do anything. And we present it kind of just as is, depending on, patient doctor discussions. The best chart type would be the line graph from how things change over time so that they can visualize the changes over the year if they wanted to do one thing in month February and then a surgical consultation in August, so they can just see where they're going with that. For number 4, how to sharpen it would be just to drill down into each discipline and go over each discipline individually with the patient. And we concluded that really it's the data-driven clinicians that were diving into why the data looked like it did. But we concluded that it was supply and demand from the previous year to understand why there was some fluctuation in physician costs and a gradual increase in surgical and decrease in mental health, so that more people were able to do it in the dark months and less surgical they were less likely to do surgical in the summer.
Nice. Thank you, Jessica. I think you're highlighted all of these points very nicely. Thank you. Now let's go to group 2. The spokesman from group 2, if you're ready, feel free to unmute.
I don't know that we really designated a spokesperson, but I'll be happy to speak on behalf of our group. Does that work for the rest of the group?
Yes, Ellen, please.
Yes,
Thank you.
most definitely. Thank you.
Thanks,
Okay.
guys.
Okay, so we looked at it completely differently, actually. We were thinking of it. We were thinking of it in terms of this would be a presentation to the department heads within this medical center. That it's more of a budgetary conversation to take a look and see which of our departments was costing the most. So and we just said comparing cost of services against the whole for a year was the answer to number one. In terms of number two, who would the audience be? Again, department heads for purposes of like a budgetary discussion. And then what is the best chart type? Just based on kind of the descriptions of how to choose what chart to use, because these were parts of a whole. These are the departments that are part of the overall, these are services that are part of the overall hospital services. So we decided that we would use a histogram would be what we would use with the services along the horizontal axis and the cost along the vertical axis. And then in terms of what conclusions or how would we sharpen the point, we thought that you could either go from highest to lowest or lowest to highest in terms of the services. And then what conclusion, and I'm sorry, my when I printed out my homework, some part of it cut off, but what conclusion can you make about the data illustrated in the chart? One of the things that we observed is that because the department costs, let me say this right, their ranking is the same. There wasn't a fluctuation month to month. So there wasn't any months where, for example, the pharmacy costs were more than the surgical costs, or the physician costs were more than the surgical costs, or anything. They were consistent across the entire year. So we could keep it simple in that term, and it showed us that. And then just the obvious that the highest, the services that are the most expensive are the surgical services, and mental health is least. So, and what we would do, we would deliver it in a PowerPoint using the histogram chart.
Perfect. Thank you, Ellen. It's very interesting now, just on the second group, how different approaches you've taken to illustrate the data and to present it to. But what I really liked, the point you made saying that the data are part of a whole, and that's something that I'm going to discuss when I talk about how I visualize the data. So thank you for that. Let's move on to our last group one. Unmute when you're ready to speak. Thank you.
All right, that is me. I didn't get my finger on the nose quick enough, so can you guys hear me okay?
Yes, we can.
Okay.
Thanks,
You're
Ellen.
Where is it? There it is. So in step one, or question one, what's the point? We said we are showing inpatient costs per member over 1 year in the 4 service areas. So that's what we had said. And then number two, we said it'd be delivered virtually to a community coalition during a monthly meeting in the form of an Excel spreadsheet with a dashboard, then sharing it via email after the monthly meeting. Audiences, hospital, nursing home, home health, local resources. So considering that diverse group, we said we felt using a chart to depict changes over time with either line or stacked column would best suit the needs of our diverse coalition audience. And then for how can we sharpen the point? I think we hit this, but maybe we're missing an element here, but maybe using color coded for each of the service areas. And then 5, pattern by month of cost, for example, whether affecting access, etc., and then utilization patterns of services and so on. So that's about what we came up with.
Well, I think that's a great way of thinking about the data and looking ahead of how you would share the data, in an interactive way, like the dashboard, and to different audiences. So that's really a good point. So this is, I personally really enjoy this. As I mentioned, this is the first time for me as a presenter during a breakout session. So I hope that you've learned from other visualization visualizing and interpreting trend data like this. So thank you all of you for participating. Now let's go over to the next slide, and I'll go over my assignment or how I answer some of these questions. So, well, I wanted to answer four of these questions, so sort out the data and see what information I needed to communicate effectively and what chart I picked. So these 5 questions, I'm gonna go over my 5th question. I was actually gonna go over throughout the next few slides. So addressing question number 1, what's the point? Well, I want to study the data by service type for cost increase or decrease over the period of the year. For question 2, who's the audience? Well, I'll deliver my data to the budgetary committee. I will first query the data, claims data, then I'll analyze the data in SAS, which is a statistical program. Then I'll create my Excel charts, and then I'll put it in the PowerPoint presentation. So in this case, I'm using 4 different types of software to finally be able to share my results. Well, analytics is time consuming and expensive. I will answer question number 3 on my next slide. But for question number 4, how you can sharpen the point, I can already tell just kind of by looking at the data table that the inpatient costs, overall inpatient costs, have increased throughout the year. Next slide, please. So to answer question 3, what is the best chart for this data? I reference my data display cheat sheet, which you guys had. So in our table, we had recorded data bi-monthly. So we are looking how things change over time, which you all got correct. For the purpose of this presentation, I decided to show you 3 different charts: the line chart, the area chart, and the bar chart. Next slide, please. Because I'm looking how things change over time, it is okay to use the line graph. In these charts, I'm showing the data for each inpatient service category by month. However, the chart illustrated on the left is a bit problematic because it doesn't make it obvious that these categories, such as the pharmacy or physician, represent portion of their overall cost. Yet in my title, I'm making the statement that the overall inpatient costs have increased during 2019. We might be making the wrong assumption because for some categories, the costs increased and for some decreased over time. But when we aggregate the data and look at the overall cost, it may cancel each other out, so the cost may actually decrease. So to illustrate my point, the chart on the right has the additional black line reflecting the total cost for all inpatient services. So representing the cost as a whole, right? So therefore, I am confident that the overall or the total cost throughout the year has increased. And my chart title is reflecting what I'm illustrating in the lines of this chart. Notice in this chart, I added the source as an important data element to display. The bottom line really is the simpler the chart with just the essential information, the easier to interpret. Next slide, please. So the second chart I chose to illustrate these data is in the area chart. From this chart, we can easily see which services had higher costs compared to other services. For example, look how the pharmacy costs increased over time compared to the mental health services, which decreased over time. By using area chart, you can really see the shaded areas getting thinner, showing the cost decrease, or thicker over time, showing the cost increase. Also, look how the top yellow shaded area gets bumped up by increasing costs from other services as we move towards December. So illustrating really the overall inpatient cost increase. Next slide, please. So in addition to displaying your data by month, you can do other simple calculations from the data table. You can quickly calculate the average cost for each of these inpatient services by quarter and illustrate it in a bar chart like I did in this slide. You can show the data quarterly in a line chart as well, but the bar chart, you'll have a more striking comparison of these service categories, especially when you want to highlight just one of these service categories, like I did with the physician services. You can then sharpen the point in your title by saying, during 2019, the average overall quarterly inpatient costs have increased, but the average quarterly costs for physician inpatient services stayed about the same. Just so you know, these three charts I shared with you, the line, area, and the bar chart, will be part of your Excel chart template I prepared for you, which will be emailed right after this session. Next slide, please. The chart illustrated on this slide is called the drum bell dots. This is completely different data than the one we've used in our assignment. We use this chart when we want to show how two or more numbers are alike or different. Notice how I added the category labels next to the data line so that my eye doesn't have to go back and forth between the legend and the line to make that association, which line represents what category. So I just gutted the legend completely to keep the chart cleaner. Also, I matched the color categories in the chart title with the data categories displayed by the dots for a quick interpretation. Next slide, please. This chart is called the Lollipop Chart. It can be used to display survey data. Again, I included labels next to each data category and added the percentage sign next to the unit I'm displaying. So I don't have to have this extra label saying that I'm displaying percentages. Oftentimes you see on the graphs display saying this is a percentage, the label percentage, and then also the sign next to the number. And on the top of it, you're also saying that in your title. That's overkill. Only if you make it clear that we're displaying percentage, that's enough to display your data. Remember, the cleaner the chart, the better. Next slide, please. Oftentimes it's tricky to copy the chart we make in Excel into a PowerPoint slide or Word document, and especially a document in Publisher, if you worked in Publisher. I thought I would share a simple trick to copy your chart from Excel into another document. I apologize if this is too simple or you already know this information, but I found it to be very helpful. I give you some screenshots to illustrate the steps. Pretty much what you have to do is in Excel sheet, you go to the ribbon menu, to the home button, then you click on the chart, then you highlight your chart to select it. And while the chart is selected, click the copy option and select copy as picture. Then a window will open with two options, which I highlighted in yellow. You want to select as shown on the screen and the format select picture option. Then open your document you wanted to copy chart to, or example Word document, and paste this as a picture, and then you're done. That way you don't lose the pixels of the chart you're trying to copy from one document to another. Next slide, please. Now I'd like to share a few data sources that CMS makes available to the public without having signed a data use agreement. On this slide, I put the link to the website on the tab where you can find these data sources, including a screenshot with the list of publicly available data. These data sources are available at no cost. Data files are updated either monthly or annually, and that information is also listed in the fourth column from the right called most recent refresh. I'll go over these sources in my next slides. Next slide, please. So the first source they make available is called the Area Deprivation Index, or ADI, which provides a number of healthcare outcomes, including rates for diabetes, cardiovascular disease, increased utilization of health services, and other outcomes linked to disadvantaged neighborhoods. These data are displayed in interactive mapping interface and can be drilled down to zip code level data. You can download the maps you make in a PDF format to your computer. Next slide, please. Now, the Food and Drug Administration data contains packaging and product information for FDA-approved drugs. On this slide, I displayed 2 data files with the data elements including in those files that you can also download in Excel format. Next slide, please. Now, on the Nursing Home Compare website, you can compare nursing home facilities, hospitals, and providers near you. You can also download the skilled nursing home facility level data and the provider data sets. Other data available for download are the measures of quality of resident care in nursing home. These data are based on the resident assessment for nursing homes. It's also referred to as the minimum data set, or MDS. Next, please. Now, finally, the zip code level data file contains zip codes and other information for cities and towns in the US. This data can be very useful if you're planning on doing some mapping with your data. Next slide, please. Now I'd like to pause for a couple of minutes and for everyone to evaluate today's session before I move on to our next slide. The link is posted in the chat. Please take a couple minutes. I think we probably are wrapping up our evaluations by now, so we can move on to next slide. And really, the final slide is just questions. So feel free to type your questions in the chat, or I don't think, maybe you can still unmute. You're welcome to, and we just can have an interactive discussion.
These were very, very helpful. Thank you, Dorada.
Oh, thank you for the feedback. I appreciate it.
So Dorota, what will people be receiving in the email then from Mary?
Yes, good question. So right after this session, we will send an Excel spreadsheet that has the chart that went over the session, has these charts included for you and color coded, and you can really, I would recommend making a copy of it, or just to make a copy of the sheet and put your own data in there or add more data to it. So it's formatted to how it should look.
I just have a quick question, Dorota. You know, when we have presentations and then you flash up a chart, I'm still looking at the x-axis and y-axis, and I'm still putting all the pieces together, and then the person flashes the next one. So is there a way to, when you flash a chart, just do it piece by piece? Okay, the x-axis is here, and we're going to measure this. The y-axis is here, and measure this. Now these pieces are, and then you put then you flash them one at a time, so that you know, I don't know. That's my problem. I don't know if other people have that problem when all of a sudden the whole thing is there, and you have to piece it out one by one and try to figure out. And then by the time you figure it out, the person's on to the next slide, and you're just you're lost. So I'm just wondering,
like when you're presenting data, is that what you're saying?
Exactly. Say, okay, here's one piece, and then here's the next piece, and here's the next piece, and then this is what it looks like all together, and this is what we're looking for. That way, you know, I don't feel, well, I won't feel so overwhelmed, and I don't know how other people feel, because when I start to to dissect these charts. It takes
Yes.
time, and I'm trying to do it real fast before the next chart is put up.
Yes.
So is
That's-
there a way to do it?
That's a very good point, Agnes. Thank you for that question. And that's something I went over in the last session. What's helpful to really communicate the charts to your audience is add the interpretation in your title. So sometimes, you know, we glaze over what's in the data table or in the chart because it looks so complex and there is so much of it. So you could just say what you want to say with those bars in the title. So maybe they could just read the title and get the point you were trying to illustrate. But those who are more you know, want to spend more time on interpreting the chart itself can start looking at that as well and get more information from what you are trying to say. I feel like there's always more than one point or conclusion that you can draw about the data you're displaying, you know, such as what's going up, what's going down, where's the overall cost. So yeah, it's almost like an art. You have to be a good data analyst. You have to be a good person, have the skills to display the data in the correct way. It's like a separate profession. But I think with having the some tricks and tips and tools that you can refer to, you can just get better with time. And yeah, that's I think a common problem with trying to display charts and presentations too much, too fast. And yeah, so thank you for that point.
Okay, thank you.
Any other questions from the audience? I just want to say I really enjoy these this session, especially because I think I have the most people on the session out of all my 3 sessions, but also just to see how you guys interact with the data and what conclusions you drew from that data table. It makes me really happy. You know, that you're thinking even about the data in certain ways. And so it's not like you don't have the basis for it is that you are still coming to the sessions to learn more. So thanks for attending.
All right, well, we can conclude these 6 sessions and thank you all for joining. I don't know, I hope some of you were able to go through all of the sessions, but you know, if we see that this is important, we'll reenact a few of these if it will be helpful in our future work. So thank you very much.